Watch this cliff face crumble into the abyss. It perfectly represents one of the most persistent, dangerous ideas in mental health, the belief that you have to hit rock bottom before you can ask for help. We are conditioned to picture an absolute, undeniable collapse, a lost career, a shattered marriage, or a tearful, highly public intervention. The reality of substance use is rarely that cinematic. It almost always begins quietly. A drink or a habit that started out as purely recreational, slowly, almost imperceptibly, shifts into a required tool to navigate the stress of a normal Tuesday. Believing the rock bottom myth forces people into a dangerous waiting game. It convinces you that until your life is actively falling apart, you simply aren't sick enough to warrant an intervention. The warning signs are internal long before they are visible. It usually starts with a quiet realization that you've been drinking or using more than you meant to, and doing it more often than you planned. That realization quickly triggers a behavioral shift. You start hiding the extent of your use from the people closest to you, putting immense energy into maintaining a flawless facade of control. Living with that secret carries a severe psychological weight. A deep sense of shame builds when you recognize you are trapped in a hidden behavior that you feel incapable of stopping. Recognizing that quiet loss of control is entirely enough. The moment a recreational activity becomes a hidden compulsion, you have a fully valid reason to check in with a professional. No public catastrophe required. Clinicians call this co-occurring disorders. The visible surface behavior, substance use, rests on a larger foundational structure. It's an attempt to self-medicate foundational pain, like anxiety, depression, or grief. Left alone, the substance eventually amplifies that same pain, creating a vicious, compounding cycle. Because the substance and the mental health struggle are structurally tied together, treating only the addiction rarely works. They have to be addressed simultaneously. The substance acts as a surrogate, a high-cost, ultimately destructive tool used to manage a deeper, untreated pain. If these patterns are so heavily interconnected, we have to look at why primary care doctors and close family members consistently miss the early warning signs. The culprit is the reporting barrier. Patients routinely underreport their alcohol or substance intake in medical settings because shame actively dictates their behavior in front of a doctor. The solution is a patient-initiated screening tool. Bypassing the face-to-face confession, individuals access an anonymous gateway to gauge their risk. Taking exactly 2 minutes with no email required, it uses validated professional metrics to provide an objective read and clear action plan. Stripping away the friction of a clinical confrontation empowers people to intercept their own downward trajectory long before they hit the floor. Struggling with control indicates that a specific coping strategy has reached its breaking point. While shame isolates you and guarantees the cycle continues, clinical compassion and targeted root cause therapy disrupt it completely. Focusing on the foundational anxiety or grief targets the engine of the behavior. When the source of the pain is effectively managed, the constant drive to self-medicate loses its power, making long-term change a sustainable goal rather than a daily battle of will. Taking that initial step is easier than ever. The 2-minute screening is completely free and available right now at chctherapy.com/mentalhealthtests. For residents of Georgia, Coping and Healing Counseling offers a 100% HIPAA-compliant telehealth model that covers all 159 counties in the state. The practice maintains a diverse team of licensed SUD-specialized therapists with specific expertise in co-occurring disorders. They accept a wide range of insurance, including standard commercial plans and Medicaid options with a $0 copay. You do not need to wait until things get worse, and you certainly do not need to hit rock bottom to prove you are worthy of help. You deserve care right now.